Good afternoon, everyone, and welcome. You are in the right place if you are here for Rise to the Challenge today, supporting the goodwill of North Georgia. We are letting attendees continue to flow in. So please enjoy some of the amazing feedback we got from women who you would like to have lunch with and why. We had a lot of attendees coming in and really giving their feedback on why these women were so important. And I must admit, I loved reading these, and it actually made me want to have lunch with more women of the past. So we are here with some amazing panelists today. We've got a great program lined up for you today. We're also here with our panel moderator, we're honored to be here with Rose Scott. So she'll be joining us momentarily and chiming in, but you are in the right place. We're going to let the participants continue to flow in, and we'll get started shortly. Thank you. Rose, it looks like you're coming to us from the studio. Is that correct?
That is correct.
Very cool. Where is the studio, by the way? I know many people probably know, but I actually don't.
Our studios are located in the neighborhood, I would say a little bit of Morningside and a little bit of the Piedmont and Cheshire Bridge area. We're actually housed in an old APS school. So yeah, we are.
Oh, interesting.
Yeah.
Now, do you share that building, that space with anyone else?
Well, right now I'm just sharing it with some wayward squirrels who got in somehow through a window. It's just me, my producer, a couple other hosts come in, but the building's been empty since last March, pretty much. We have a few people come in, production people, but no, it's just us. It took some time to get used to it, but I kind of like it now because I get to make the coffee the way I want to make it. Yeah.
That is true. There's actually truth to that. And I've heard, it's funny, my husband and I were even talking about this, the workspaces are going to change so much. I mean, speaking of how we're talking about workspace today, there's going to be a huge shift, I think, in the way that people work from home. I think businesses are probably going to see and understand what the true value of having office space means and whether or not it's worth continuing that investment. What have you heard? I know you've got your finger on the pulse there.
In terms of just in general or our situation?
Well, I'd say both. I mean, your situation and just in general of how the workspace is going to change for us.
I think that given that a lot of our departments were pretty close, tight in tight quarters, I think we may probably go to some type of hybrid. Maybe certain departments come in on one part of the week and another come on other days. There is something to having guests in the studio. I like that face-to-face interaction. Right now, all our guests are via Zoom, but we'll certainly make that option. We've had some modifications where we think that maybe later in the year we can start having maybe one guest in and everybody else be on Zoom. Because who knows with this pandemic? I mean, that's why we looked at people like, Dr. Valerie Montgomery Rice and everyone else to kind of guide us through all of this. I've had at least 7 COVID tests since last year. So I've kept my little bubble very small. Just have to see,
Yeah, there's no doubt I just had a COVID test this week, actually, because I was a little under the weather, and luckily I think it was just a daycare cold. But I think it's going to be really interesting the way that the workplace is shaped. And I think a lot of people, I know we're going to talk about this today, but I think a lot of people have also started to have a different appreciation and understanding for what it's like to care for your own kids at home.
Yeah.
and how that's going to impact the workplace, and the empathy I think that bosses have for parents, working parents, because trying to work and take care of a little one is quite the
Mhm.
challenge. So I'm sure that many people on the call today can relate to that. What if your what's your experience been on with some of the people you've interviewed over the last year, and how their work has changed?
Well, a big part of what we've been doing, because obviously we felt it was important, was to really highlight, what were the resources out there for people, and I said this yesterday. I had another virtual event with the Atlanta Women's Foundation, and I've just been so just blown away with the amount of support and resources for people here in the Atlanta area. But I think that we're going to see a shift in the workforce development, which we will talk about today. But I think also with that shift, we're going to see a lot of uncomfortable uh, and, quite frankly, sad situations. I'm concerned about people who will be evicted. I'm concerned about people who are
Hmm.
already being priced out of their community. You know, so Atlanta's going to shift after this pandemic. Now, which way it shifts, that's the question.
Well, I guess that'll be up to us too as a
Yeah.
community as to how we respond to that, how we show up. And I know that even in planning this event, we were hoping that we would have 100 people on. That was kind of the goal, and to have 256 people register for the event alone
Yeah.
was just outstanding. It just shows how many people really want to participate and hear and learn. Speaking of which, speaking of children, we did just launch a poll, so hopefully everyone sees that. We're asking, how often do kids make a cameo in your virtual meetings? Now, whether that's your own kids, right, or
Yeah.
you're in a meeting with someone else and a kid runs by in the background, we'd love to know, how often are kids making those cameos in your virtual meeting, or are you seeing parents put themselves on mute and you can see them
Well,
talking through their teeth like this? You better sit down,
I've
right? So,
well, in my house, I've had my 14-year-old Maine Coon cat make several appearances. He's become a quite little star. But I've had other instances where I was interviewing people and maybe a dog was barking, or a kid was, running around, or, there was construction taking place, or, but it's been yeah. I love the fact that people have really taken to sort of setting up their Zoom, staging their house. I mean, who knew, right? So the great thing I like is that when I'm at home and I'm doing a community event, I just gotta look pretty decent from the waist up. I can have on pajamas on the bottom, so I'm okay with that.
you know, I love that. I'm an auctioneer and MC by profession, and owner of a event company, a fundraising event company, and that's actually how we got involved. But I've had to do a lot of virtual galas over the
Yeah.
last year, and I have been wearing my gala gowns with slippers. I mean, with my like
Yeah.
bedroom slippers, and I'm
I think
like
that's
full hair,
okay,
makeup, the
Yeah,
whole thing, and got my bedroom slippers on because nobody knows, and it's definitely more comfortable than walking around in 3-inch heels.
absolutely.
So, looks like we still have some people flowing in, but we do want to get started pretty quickly here.
Mhm.
If everyone wants to check out the poll, we do have another question there for you. If you can respond, you see the numbers ticking. Since the pandemic, are you seeing more emails outside normal business hours? Um, Looks like most people are saying way more, especially after 5 p.m. I know for us, we have definitely seen that in working with primarily nonprofits, and nonprofits are one of those other niches that are going to be impacted
Mhm.
definitely by the pandemic, and dollars and support. So it's good to stay involved with your nonprofits that you care about.
And real
All right,
quickly, who's doing the
sure.
housekeeping so I'll know who to
I'm
thank?
going to go over some housekeeping, Rose,
Okay.
and then I'm going to toss it over to you just to kind of get that out of the way so everyone feels like they know what's going on, and then we
Good.
can
Good.
jump in.
All right. Cool.
So, ladies and gentlemen, welcome to Rise to the Challenge presented by Goodwill of North Georgia. We're so excited that you're here. Thank you for joining us today on your lunch hour. My name is Megan McRoberts, and I'm the founder and CEO of Panelist Impact Agency. We had the privilege of helping Goodwill put this event on, and we're super excited to be here today. Do just have a couple of housekeeping notes to make sure that we're all on the same page and to make the best of our time together. We are going to drop these in the chat for your reference, so don't be concerned if you miss anything. So we do have 5 panelists today, and amazing panelists. You are going to love hearing from them. I sure am excited. So for the best viewing experience, we recommend that you maximize your screen to full screen in your Zoom window. All attendees have been muted, and the chat feature between attendees has been deactivated in order to really focus on our panelists today. But we do want to hear from you. So please drop your questions right into that Q&A box that you see at the bottom panel of your Zoom screen. You can direct a question to a specific panelist just by saying, hey, this is for Dr. Valerie Montgomery Rice, or you can ask a blanket question. And we are going to do our best to answer as many of those live. Some of them may be answered in the Q&A, but Rose is going to incorporate those throughout the conversation today. Lastly, if you have any technical issues whatsoever, please feel free to call our tech support hotline at 404-882-8552. Again, I'm going to drop this in the chat, so no need to write it down. And that is it. So easy peasy today. We hope you enjoy the discussion, and we hope you learn something along the way. We look forward to hearing your questions and hearing from you afterwards. It is now my pleasure to introduce you to Rose Scott, veteran award-winning journalist, host of Closer Look on NPR affiliate 90.1 WABE. Take it away, Rose.
Thank you so much, Megan, and welcome everyone. Welcome to Rise to the Challenge, presented by our good friends at the Goodwill of North Georgia. Can you believe today marks 1 year when the World Health Organization declared the coronavirus a pandemic? Take a moment and think back to where you were a year ago. What was going on? Think back now to maybe we'd be working from home for maybe a few weeks, maybe a month, maybe just throughout the summer. It's been 1 year, and for many of us, some of us are still working from home. Now, some of us are still coming to work. As you can see, I'm still in the studio. We kept working. I'm here with my producer, Grace Walker. She's still working. And we're at a safe distance, so don't worry. We're practicing all those measures that Dr. Valerie Montgomery Rice would probably scream at me for if I didn't. But here's what we also know. Here in the United States, more than 533,000 have lost their lives. We know that the unemployment rate for all Georgia women doubled from 3% before the pandemic to 6%. And we know that women of color have most been impacted by that. We also know that as of last year in December, 1 in 4 child care providers remained closed. And we know that remote learning continues to challenge women and girls in our community. And we also know this, it's estimated 5 million women left the workforce. And that's what today's discussion is about. We're going to focus on that. And we have an amazing panel. But first, I always like talking to people about their journey. And our next person I'm going to bring to the panel is someone who can talk about her journey. Her name is Veronica Lightburn. She's a ServiceNow training coordinator at Accenture, and she's a Goodwill Technology Career Program alumna. And she's going to tell you more about that. But I will tell you that Veronica was accepted to the program in 2019. And after she graduated, well, she'll tell you her story. And it's a story that you want to hear. Veronica, welcome. Good to talk to you again.
Thank you. Thank you so much, Rose. I'm so happy to be here.
I want you to begin by reflecting on what the last year has been like for you.
The last year has been busy. I started a new job at Accenture, and the work has not stopped, but it's so exciting, so much to learn. It's been a really exciting but busy and different year, to say the least.
Yeah. I also want to go back maybe 2 years. Veronica, tell us what life was like 2 years ago for you.
2 years ago, I was a customer service rep, answering phones, 9 to 5, trying to get by. And that was the industry that I was really comfortable in. I always loved talking to clients, assisting in any way I could. So being on the phone was a safe, comfortable hub for me.
Mm-hmm. And then, but what were your career goals back then as well?
My career goals back then, I wanted to get out of the customer service industry. I didn't know how.
Mm-hmm.
I applied for jobs and I looked at certifications, but I wasn't exactly sure how to navigate that journey. And then I was blessed enough to come across the Goodwill Tech Bridge program.
When you say you were blessed enough, how did that happen?
My partner, Kiera Powell, my partner, she was like, hey, it's this program. I got an email. I'm going to apply. You should apply too. And I was like, me, a tech program? They're not going to let me in. I don't know anything about tech. And she said, no, they're really interested. You don't have to have any experience. Try. And I applied, and amazingly, I was able to get in.
You said you were concerned that they wouldn't take you.
Right.
Was that just because of your perception of what type of individual would be in some type of career in technology?
Yes, I had no previous tech experience whatsoever. I had at the time a daunting fear of coding. So I just felt I wouldn't be a candidate, a qualified candidate. And I was exactly what they were looking for. And it's been a wonderful decision to apply ever since.
Now think about, Veronica, if you had said, no, I'm not going to do it.
I'm so happy I did. I'm so happy I did.
Let's talk about the program. Take our viewers here who are joining us today on what that process was like.
So the program was typically 3 to 4 days a week. It was after work. So I would go to work, get off around 5, get to the program around 5:30. It'll end at 8:30. So about 3 hours. It was about maybe 4 or 5 Saturdays, which is around 9 a.m. to 2 p.m. But it was filled with so much technology information. I learned Scrum. I learned to code. I even won 3rd place in our class coding competition. So,
oh, wow.
Right. I learned a lot. And we also got into ServiceNow. That was the last class we took. It was very intense. It was very, the big kahuna, as I called it, because it was nothing to play with at all, but it was so rewarding in the end. I truly loved the program.
Well, I also want to revisit when you were offered a job.
OMG, Miss Rose. When I was offered the job, I got off work, normal day, got off work, got home, and I got a call, and they had to speak to me. I was like, it's me. And she said, yeah, we're calling from Accenture and with an offer. And I said, me? And I said, wait a minute. Are you supposed to be talking to Veronica Lightburn? And she was like, yes. And I was like, okay, I'm getting punked. Bring Ashton Kutcher on the phone. Like, come on. Like, oh, you're the funny one. They told me about you, but no, we want to offer you a position. And I dropped the phone. I was so amazed. I was so ecstatic. I was just so honored and so grateful and very, very surprised, to say the least.
You keep saying you were surprised, as if you had the skill set to begin with, right, and then it was enhanced. I got to ask you this: who's the first person you called once you got the job offer?
The first person I called was my mother-in-law. I called my girlfriend's mom, and we screamed and yelled and we prayed. And
that's what mamas do. They let's take a moment. Let's thank the Creator.
Exactly. Yes.
Now, what are your career goals, Veronica?
My current career goals, I'm a training coordinator. Mm-hmm. Got in that role not too long ago. I'm still getting comfortable, but my goals now, I want to be able to be the training coordinator lead. I want to be able to elevate, learn as much as I can in that realm, help my team out as much as possible. I have some awesome teammates, awesome managers. So I really want to excel in any way possible to just elevate and grow within the company.
And that's what it's all about. And that's a big focus of what we're going to continue on. Veronica, hang with us. Don't go anywhere. That's a big part of what we're going to continue on with our panelists as we discuss How do we get more women back into the workforce? Veronica has a great story, and we are very happy for you. Lunch is on you for all of us now that you got this job at Accenture. But
Yes.
we also want to continue the conversation, and I am very honored. A lot of these folks I've already interviewed, so they know me, they know my style. But I'm going to bring them in. First, let's welcome Katie Kirkpatrick, President and CEO of the Metro Atlanta Chamber. Somebody else you all should know, Keith Parker, President and CEO, Goodwill of North Georgia, Goodwill Industries of North Georgia. Dr. Doretta Rhodes, Executive Vice President and Chief People Capital Officer for the Atlanta Braves. I root for the Braves, but not when they're playing the St. Louis Cardinals. I'm sorry, Dr. Rhodes, please forgive me. And a woman who I've enjoyed speaking with over the last few years, who has been on the forefront of making sure people of color are not going to be forgotten during this pandemic. That is Dr. Valerie Montgomery Rice, President and Dean of the Morehouse School of Medicine. Thank you all. We got everybody?
Hi, Rose.
Hey,
Hey,
Keith.
Rose.
Hello,
Hi,
now we got
There was
everybody.
a momentary glitch, I think.
That's
Hey,
Rose. I'll
we're
let you
here.
know about the thing with the Atlanta Braves. We'll have another conversation later on. about
okay,
that.
Dr. Rhodes.
And I love that Veronica was afraid of getting the job. Then she got the job. Now she wants to be the CEO. I just love that.
Hey.
That's the attitude that she should have. Wow, that's great. I want to start because I think we should acknowledge this moment that we're all in this space. And Dr. Valerie Montgomery Rice, I'm going to start with you because when I talked about how folks like you have been on the forefront to make sure that people who look like me, people who look like you, and our Latina brothers and sisters, just reflect on where we are now a year later with this pandemic through your lens.
So thank you, Anna, and I love sharing this platform with the other panelists. And thank you, Keith, for bringing us all together. Rose, you and I have talked about this a lot. You all, I remember this time last year. I was actually at a golf tournament and they shut down the golf tournament. And when I came back the next day, I got a call from the organizer saying that someone at the tournament had been positive. And I actually had to go into quarantine for 14 days. And you all, it wasn't that easy at that time to get a test. And my husband said, you're not going to act right. So he actually carted me off to a place that I would not be able to get away from, because we really did think, right, I needed to quarantine for 14 days in case we had been exposed. And luckily we were not. But during that 14 days, I was in every day on communication with my team because we had to shut the school down like everybody else. And I immediately knew as a scientist that testing would be important, not just for identifying cases, you all, but also for us being able to develop a strategy that provided us with some security and control over this virus so that people would know when they were positive and they could quarantine. And then we needed the contact tracing so that we could isolate people and all the things that we needed to do. So I immediately reached out and to an entity that I knew that was going to turn their platform of genomic testing onto testing for the COVID-19 virus. And we started that immediately at Morehouse School of Medicine. So we have been testing everyone in our organization since April, every 7 to 14 days. And we created a platform for people to return to work with security, understanding that washing your hands, wearing your mask, and watching your distance, along with testing, could be that opportunity. But it was a lot of work, and it required teamwork, and it required resilience and grit, and it required trust. So Rose, when I reflect, it's been that type of journey. How do we build trust and rely on the science?
And Dr. Montgomery Rice, I do want to get one more question into you before I move on, because I know it wasn't lost on you and other scientists that this virus was going to disproportionately affect certain demographics of our society, Black and brown communities, perhaps low-wage earners. That was not lost on you all. And now a year later, that's where we are, still talking about that population.
We saw that initially, And Rose, what we first tried to make sure, again, following the science, that people understood the fact that just because you were Black was not the risk factor, or you were brown, that was not the risk factor. It was the fact that you were an essential worker, that you lived in a multi-generational home, that you were engaged in activities that did not always allow you the opportunity, like many of us, to work from home. You were those essential workers who were delivering our packages, delivering our mail, working in our food service and hospitality industry, keeping our energy grid going. And we needed to recognize that. It took us a while in this country to get rid of that rhetoric so that people understood it wasn't that. And then the second thing that this virus did, it pulled the curtain down on the long-standing health disparities. And because this virus affects the vasculature, any disease like hypertension, diabetes, heart disease is going to be disproportionately worsened if you get the virus. And that unfortunately occurs more in Black and brown people because of the long-standing chronic health disparities that we see in this country. So we talk about those social determinants and all of those long-term inequities. This virus pulled the curtain down on those. And we had to assure the working class community that they were not going to be left behind. So we thought that opening up at Morehouse School of Medicine, because we couldn't educate and train medical students by Zoom only, our PA students, our clinical people, et cetera, that we would also be able to serve as a role model for what was possible.
And Katie Kirkpatrick, let me bring your thoughts in on this, because we know that this pandemic not just affected baseball, which Dr. Rose would talk about, and all the sports leagues, they shut down. Mom and pop businesses that rely on people coming in every day. Talk about how that, and over this past year, how that has impacted small businesses. And I mean the small businesses.
Well, what's interesting is to follow Dr. Valerie Montgomery Rice on this, because equity has been the theme throughout the pandemic, not only in the health space, but economic and racial as well. But on the economic front, we know that the small business community, which oftentimes is where our Black and brown business owners are, has been disproportionately impacted by the pandemic. We also know that the small business owner has also struggled to access the supports that the federal government put in place, like the Paycheck Protection Program. At least in the first two iterations, there have been challenges with getting funding to the small business. And then the third piece with small businesses, how did they didn't have that natural supply chain to accessing personal protective equipment. And so they were disproportionately impacted as well on providing that frontline protection if their business was able to stay open. That was a huge concern and cost for a small business as well. So the year, I still am a little bit shocked to say that we've been at this for a year, but truly the small business community, those that rely on customer interfacing businesses, especially those in entertainment and retail, have been impacted. And most of those folks employed folks of color. And when we get ready to talk about women and then the impact of women, the one last piece I just add is when Dr. Rice was talking about the way that the school, really kind of rallied around building this trust, we also know that women comprise the most significant portion of our healthcare population. So I think it's roughly, and Dr. Rice can correct me if I'm wrong, but almost 80% of nursing staffs are women, and somewhere on average of 65 to 70% of healthcare workers in general are women. And so as we get deeper into this conversation, it is interesting to look at the intersection between women and healthcare as well.
Absolutely. Dr. Doretta Rhodes, let me bring you into the conversation, because you are with an organization. Were you all able to help your employees to keep them on the payroll as you reflect over this last year?
So that's a great question. When we shut down the office on March 16th, we still thought that we were going to have opening day. So the hope was that this was only going to last for a couple weeks and we were going to be able to start playing. And of course that did not happen. And as a result of that, not only did our ball league do things for our workers, but across the MLB, we were very intentional around knowing that we weren't playing games. We got to a point where we knew that we weren't going to have fans in the stands and that we were not going to be playing games as you typically would see with fans and that type of environment. And so there's several different things that we did from a community perspective. There's several different things that we did. We had an actual ability for individuals to, if they needed the assistance, that we provided assistance for our game day staff. And that was really important to us because that was our largest staff that was impacted by the fact that we weren't playing games. I think Dr. Rice made a really good point. You have those organizations where if you're able to work from home, it was easy to send people home and you had that infrastructure to do that. Well, as we talk about the essential workers, a consideration for our game day staff was just that. If you're not playing a game, they're not having the ability to come here. And our tenure of our game day staff, we have individuals that have been with the Braves for 20 years plus. And so it really was imperative to us that we figured out what were the things that we could do to help and support them during that time. The good news is that we are looking like we're going to start playing a modified season. But it was tough for that whole year in terms of the environment that we were in to try to support our staff. And I think as employers, we were at this point, we had never experienced anything like this before, and trying to figure out how to support our staff was just so critically important.
Yeah. And Keith Parker, you and I have had a conversation early because you talk about an industry that was at the intersection of a lot with what the work that the Goodwill industry does. You're training people, you're providing jobs for folks that might normally have a difficult access to getting jobs, and then you rely on people to come into the stores. How did you all navigate through this last year?
With a lot of planning and good fortune, both things had to come together for it to be successful. We early on decided to keep all of our people whole as we possibly could. So when we shut down all of our stores and all 3,000 of our employees, we still kept on health insurance and kept paying them. Very few nonprofits were able to do that. And it cost us millions of dollars, but we're glad we did it because of two reasons. First, it's just the right thing to do. If we're going to say our mission is to put people to work, it's tough to then lay people off. But then secondly, it gave us a stronger group when we did reopen. So when we reopened, we've now had a record-breaking year in terms of revenue, in terms of donations. And we're seeing more and more people who are able to help, not just get a job, but a better job and then on to a career. But Rosie, I got to take one quick moment here, if you give me a moment of privilege here. And let's look at the women on this panel.
Yeah.
When I talk with people and they say, we can't find talented people, we can't do this, we can't do that. We've got the head of a medical school. We've got the CEO of one of the most powerful chambers of commerce in the country. We have perhaps the highest ranking female of a Major League Baseball team. And we have a young lady who dispelled all sorts of misnomers out there about can women handle STEM type jobs. None of them are unique. They're all special, but none are unique because there are other women who can do these things too. So I want to take a moment to just say thank you all for joining me on this panel, because just being here dispels so much, improves a lot.
And they're all role models and sheroes in my book. I want to take a deep dive because Dr. Valerie Montgomery Rice talked about how this pandemic pulled the curtain down on health disparities. But listen, we also knew, and I don't know why folks act surprised when they realize that, you know what, there's a wage gap between men and women. There's a issue here about the cost of childcare and school systems not meeting the needs of working mothers. That's not new. Or as my granddad would say, that ain't new. So we have this pandemic that pulled the curtain on all of these issues, all of these disparities. And so now the conversation last year has been, when we get back to normal, how do we make sure this doesn't continue? Katie Kirkpatrick, I want to start with you. I've asked this question so many times. You can rely on the government. You can rely on state and local government. You can rely on public and private partnerships. You can rely on nonprofits. To me, that says it takes a holistic approach when we talk about how do we bring back, if possible, those 5 million jobs where women made up more than 50% of that workforce. How do we bring them back since last February of 2020? Where does it begin?
Well, I think it begins with quality childcare and with our schools being reopened. I mean, that's the I can't, without those two institutions being fully up and running, then we can't see mothers feel functionally like they can get back to work. It's just very simple. And Rose, several years ago, we began doing a study with Gears. I think everybody knows or is familiar with Gears, called Opportunity Lost, looking specifically at this issue around childcare and the impact that it has on our workforce and our economy. There is actually an economic case to be made here when we're thinking about quality childcare. And part of the research that we did, 1 out of every 5 women who are working women have turned down a job offer or a promotion because of concerns around childcare. Okay, that's concerning, especially someone that's looking to fill jobs. We need our workforce to feel like they have that full support system around them. We also know that in rural areas, up to 10% have been reported that they have been fired due to childcare issues.
Wow.
And so the numbers I can keep going on, but we know pre-pandemic, so only imagine what it looks like now, but pre-pandemic, it was about a $2 billion hit to our economy for not having a full complement of childcare, quality childcare in our community. So there's an economic argument to be made there. So maybe where I want to end here, Rose, on this piece though, is to your point, it takes a whole suite of solutions. So there are certainly government opportunities here. There is a program called, and I always get it wrong, Child and Parent Services Program, CAPS, that if we work to expand CAPS, it is a good subsidy to help those working parents go back to school or go back to work. So that's the important part. But there are other things that companies can do, right? That's a government support. Companies can look at doing things like subsidizing childcare, paid family leave, flexible work schedules, which I think we all agree that this pandemic now is starting to ask the question what that can look like. But when we think about the essential worker, that flexible work schedule is not as easy to accommodate. So we still have work to be done there. And the last piece I'd like to say is that if we think about that business ecosystem, most of our childcare providers are small businesses owned by women. So we are in turn supporting small businesses, women owned, if we can get the types of supports, both philanthropic, private, and public in place, that in turn will help women have at least a leg up of getting back into the workforce.
Dr. Valerie Montgomery Rice, let's be clear. If folks aren't healthy, they can't work anyway. And so if this pandemic has pulled the curtain on health disparities, and I know sometimes folks like you don't like to get the government, the politics question, but what has this pandemic showed us about health insurance and just overall how the United States has its approach to healthcare in this nation?
It has shown us that we have multiple opportunities for improvement. And one of the things that I will say is universal health care is essential. Now, I actually don't want us to get caught up in the rhetoric of whether it's Medicare for all or Medicaid for all or Obamacare, whatever you're going to call it, because that's talking about who's going to pay for it, you all. Okay, let's not get caught up in that. Let's get caught up in understanding that universal health care, that every individual in these United States deserves to have a foundational level of care that is provided to them on a need basis and an annual basis so that we can get into prevention and wellness. And if we can get beyond the rhetoric of how it gets paid and what we term it, whether it's Medicaid, Medicare, then we can move towards something. It's just like we've gotten to with the vaccines. Now, we made mask wearing political, and I'm saying we with quotations or air quotations around it, because some of us did not, but I'm trying to be kind. And so there's nothing controversial about wearing a mask, protecting yourself and protecting others. There's nothing controversial about washing your hands. There's nothing controversial about watching your distance. We need to move beyond the controversy of the vaccines. Science shows, and we see it as evidence right now, that what? We are seeing deaths go down, rates go down. We're seeing hospitalization rates go down. And now we're seeing cases go down. Guess what? We as scientists knew that this would happen if we got a vaccine on the market, and now we have 3. So now we have to put the right type of public-private partnerships in place to address the supply. And you saw that happening this week, when I think it's Pfizer somebody's partnering with Merck. I can't remember which one it is, because I'm just not that in, because I don't really care how it happens. I just need for it to happen. They were removing the barrier. I think it's Johnson & Johnson partnering with Merck to now we're going to get that. We're going to get more of that vaccine available. You see, the government is now having more opportunity for purchasing. So we're not going to have a supply issue, but we got to distribute it. And we got to distribute it in an equitable way. So I'm really excited. We have our first Health Equity Council meeting today that I am chairing, and we're going to be talking about the equitable distribution. And then we have to have those trusted entities there to message why people who are hesitant should get the vaccine. If we get 70% of us vaccinated, you all, we will psychologically and physically and medically actually change the paradigm. We'll shift the curve on this vaccine, this virus control in our lives. So it is really important that we get the politics out of this and let science lead. And then, Rose, what's really key to me is that we pull together the wonderful private assets we have and public assets, and not be so concerned about who gets the credit. But let's come up with a solution and make it work. And can I give one comment also on something that Dr. Rose and others said? And Keith talked about this too, how important it was to keep people employed, even when their work required for them to work in the community, and they couldn't work from home, but we kept them employed. Remember, you all, we gave people dignity with that. We gave them pride. You think about Dr. Rose talked about the people who had been working for 20, 25 years in the Braves stadiums. And this was their livelihood. And that was taken away from them. But if they were still able to get a paycheck, how important that was. So I do applaud the work that has been going on for getting these stimulus packages there and getting this money out, because to keep people employed and to keep a paycheck coming in for them, even when not due to any circumstances of their own, that they couldn't do the work, showed that we appreciated them and saw them as an asset to this country.
Thank you so much for that, Dr. Valerie Montgomery Rice. Dr. Rhodes, listen, if we're going to follow this path of what Katie Kirkpatrick just talked about and Dr. Rice just talked about, okay, women are now going to come back into the workforce. They've been vaccinated, they're ready. So now here's the challenge. Are they on a path to increase their wages, to increase their income? I don't have to tell you all about the statistic as it relates to how much women earn on the dollar as opposed to their male counterparts. We all know that. So Dr. Rhodes, what is the solution there to make sure that companies, if they can, have a career path for women who are coming back into the workforce after this pandemic, or when we get to whatever that looks like, getting to the other side of this pandemic?
So I'm going to say something that both you and Katie said. The normal that we thought of will never be the same. It really won't. I'm looking at research now that talks about the human resource trends, and the fact of what happened in the pandemic is shifting everything that organizations, that government institutions are having to look at and do, because we can't do what we did before. And Katie said it's about making sure that we have childcare and making sure that schools are open so that individuals can go to work. I'm an empty nester, so I didn't have children at home. I don't know what I would have done if I had to manage having small children, dealing with the pandemic, trying to figure out how to do work and what that looked like, and then being concerned about my wages. And I think that coming out of that, to your question, Rose, of what I'm hearing is that, will there be a trajectory? I think we don't have a choice. I think we're going to have to start looking at careers and trajectory of roles very differently than what we did before, and it can't be the normal that we did in the past. So that's speaking to if we had another pandemic, because this is the conversation that my professionals of mine that we would have around the world actually, is the fact that none of us had experienced any of this. Like, we could talk about the experience of 9/11, we could talk about what those were. None of us that are living today have dealt with the pandemic that impacted the world the way that it did. And so at that point, it screeched things to a halt around not only childcare, not only schools, but also what are employers going to do? I will be honest with you, for us, from a Braves perspective, we didn't work from home. That was not even a thought process for us. People came together, they collected, it was community, it was all of those pieces. And so not only are we going to have to start thinking about trajectory, but we're also going to have to think about mindfulness and how not only is it the physical health of people, but it is the mental health of people, and organizations are going to have to take a different stance. I am thankful and thoughtful around the fact that we have a benefits program that has been worked with us very well around how we needed to do that for our staff. I know all organizations aren't like that, but we're going to have to blend this career trajectory with the physical health of people, and now with the mental and mindfulness for people as well. And it is going to have to start with childcare. What are the things that we need to do? And those traditional jobs that we said, oh, we can't do flex, guess what? Yes, we can. Like, we now can figure out how to make that work, because I love the word that Dr. Rice used around dignity. That is what this is about, and ensuring that people can remain and have their dignity through this type of crisis that we've dealt with.
And Keith Parker, you of all people know that when we talk about quality of life issues, we'll get to some of your questions in a moment. One of them, we talk about transit and mobility. And I want to bring that in because that's also an area of your expertise. But also remember now, when public transportation had to shut down, that also impacted folks who still had to go to work, essential workers. So now as we move to this other side of the pandemic, when you look at workforce development, health and wellness, education, housing, transit and mobility, those are our 5 key areas that we focus here on Closer Look. Keith, when you put all that together at the intersection of bringing women back into the workforce, how crucial is that all 5 of those sectors must be on par to what everything that Dr. Rice just said, Dr. Rose just said, and Katie Kirkpatrick?
Well, thanks for saving the easy question for me. I appreciate that. But no, I think the big thing we have to do, and what the women on this panel illustrate, is broadening our thinking. That too often we think of certain jobs as women jobs, but we think of certain other jobs as jobs just for men and so forth. And what we happen to know through the historical legacy of sexism and what have you, is that women have very often been put into jobs that didn't pay as well. So a big part of our emphasis at Goodwill is helping women get into non-traditional fields. So when people say folks aren't strong enough, for example, to work in construction jobs, as a part of our training, we actually help women get physically stronger, help them literally get physically stronger, help them get more comfortable with being in front of the computer, getting more comfortable with doing a whole host of things that, again, have been traditionally told that's not something a woman needs to do, or that that's a job for a man. The maintenance jobs, the construction jobs, the jobs, again, that pay typically a whole lot more. So our goal is to meet people where they are, assess what their needs are, and then work out a plan for that initial job that they might need just to make ends meet right away, a stepping stone position to get them to that better position, and then, like Veronica is illustrating to us, onto a career. But all those segments have to come together, the transportation component, the childcare component, all those different pieces.
Mhm.
So we have to be partners in this discussion. Katie very well knows that that's what all of us are having, these big discussions about how we move Atlanta in general from being a place where we are disproportionately bad at moving people from poverty onto affluence. How do we get them to get those other areas? By partnerships, partnerships, partnerships.
And speaking of Veronica, because I'm in the Q&A, and Veronica, you got a lot of questions, so I hope you're ready. I want to start with this one. It's from Dale. And Dale says, can you share more on how Tech Bridge and Goodwill of North Georgia prepared you for your role today?
Tech Bridge and Goodwill prepared me for this role by putting so much in front of me, teaching me from beginning to end, from professional development to savings. We had savings classes, and what do you do when you get this new salary, and how do you manage your typical 9-to-5 experience to now to being in STEM. They really helped me and molded me every step of the way. They gave us mentors, they gave us lunch, it was so many opportunities to grow and elevate. And they held our hand every step of the way, which was really needed and necessary for us to all grow together.
And then someone, I believe it's Dree, wants to know, did you get a job in tech immediately after the program? I think we kind of answered that, but I'll let you take it further.
I did. After the program, it was we had graduation, and I got my offer a day after graduation. So it was a big Christmas gift that year. It was a really big Christmas gift, but it was right after our graduation for the program. Yeah.
Wow. And again, congratulations. Dr. Montgomery Rice, I apologize because I didn't want to get you caught up in this, but here's a question from Susan for you. What will it take to get the state of Georgia to expand Medicaid so that all our citizens can have access to health care?
So I think that what I have been focused on, again, and I talked about this earlier, I'm not going to get caught up in the rhetoric of what it's called, but I am very consistent in my conversation of universal health care. And I am willing to talk with anyone around the table, governors, commissioners, legislators, et cetera, about how we get more Georgians access to care and access to a higher quality level of care. And I am open to what that looks like. Now, Medicaid expansion is one option, but I'm not going to lose any opportunities fighting just for that one. Okay, so it may be an incremental process, but I want to make sure that we can get aligned with universal health care, regardless of how it gets paid. Okay, regardless of what that format is, or regardless of what that title is. So I am willing to and do have these conversations with legislators, the governor's office, et cetera, about universal health care. And we will use the challenges that we've seen with this pandemic to continue to show people how important and why it is relevant that we have universal health care. It is a preventive health measure. Mm-hmm. If we had more people in the system, we could have tracked more of the cases and perhaps have gotten people quarantined and isolated and tested sooner versus everybody coming to the emergency room. And many people came to the emergency room because they had no other resource. So we need to learn from this experience.
I have a question here that I would like for Keith and Dr. Rhodes and Katie to answer, if you can. Do you think increasing the minimum wage is a start in all of this, what we're talking about? Dr. Rhodes, your view on that?
I do not, and I'm going to say to you, that's not going to be a public. Everyone's not going to like that as a answer, but I do. Again, it goes back to not only equality from the standpoint of making sure that individuals have equity wages. I think it's really critical for people to have living wages outside of just being able to have the unemployment number raised, I think organizations need to look at a living wage first. And then when you do that, it does come down to what do you do for career development? What do you do for continued career trajectory so someone can continue to have pride in what they're doing and how they're getting supported and how they're being professionally developed, much like Veronica has experienced. So I do agree with that, but I'm going to be honest with you, Rose. I don't think it's just minimum wage. I think it's living wages that we as organizations need to start being focused on first, and then figure out the rest. Now, that's not going to be a popular comment I made, so I'll just say that up front, but I do think as an employer, that's what we need to start looking at.
And Rose, I'll build off of Dr. Rhodes, and I just realized I don't have a doctor in front of my name. I need to go back to school. But to build off of what Dr. Rhodes was speaking to, I think we also need to think about pay equity. That is also an important part of this process, is taking a look at how we actually pay in the workplace and is it equitable. So there's one thing about minimum wage or living wage, but I also think there's pay equity that has to be factored into that conversation to ensure whether or not it is based on gender or race or whatever the defining ability may be. We need to be taking a hard look at the pay equity piece as well.
Keith Parker, what do you think?
So there are three different segments of low-skilled workers. There is the high-skilled, low-skilled person, the middle-skilled, low-skilled person, and the low-skilled person. When the minimum wage goes up, that highly skilled, low-skilled person is the one who benefits the most, because he or she can immediately take advantage of it. They're producing at a high level. The employer gladly pays them that amount. Their life changes because their wages go up. There's that middle segment person who, with a little bit of nudging, a little bit of help, a little bit of training, can then get to that high skill level, and they can produce at that higher minimum wage level. But then there's a low skill worker, a very low skill worker, many of whom have not even worked, many of whom are in their 30s, have never really had a job. And what we've seen around the country when the minimum wage has gone up, that particular worker has actually been left out of the workforce now completely, because where maybe you could have afforded to pay that person $7.50 an hour to produce at such a level, at $15 an hour, that person is no longer viable as an employee. And that's where Goodwill and other groups can come in, because we can start building that person up so that they can then not get the $15 an hour because the law changed, but because they now have a skill set and they're producing at that $15 an hour.
Keith, I want to stay with you. I cannot believe that we're almost out of time here, but this is a question you all will get. But Keith, I'll start with you. If there is a takeaway, or one takeaway that you want folks to remember today, as we look at what happened this past year and where we hope to be maybe a year from now, as it relates to women getting back in the workforce, what is it?
That even amidst the crisis, the two things I always remember is that collaboration gets you further, and there is opportunity within that crisis.
All right, Katie Kirkpatrick.
I'm sorry, I just happened to look at the Q&A, and Veronica got a shout out from mom and dad. So
you spoiled it for me, Katie. I was going to surprise her.
I'm sorry, my eyes started to tear up. So in terms of a takeaway, well, one, I think when we round the corner in the vaccines, we get to that 70% or 80% that Dr. Rice talked about, the intentionality in the business community and with partners must be focused on those that have been left behind because of the pandemic and those that had already been left behind before we entered the pandemic. That intentionality has to stay, if not at the current pace, at a higher pace. And then the last thing I would also add in is that when we think as employers about women and benefits, we also need to be taking a look at not just health, but mental health benefits. And I would encourage employers to really be looking at what they offer at the moment, because we know that the pandemic has taken a toll, and we need to be able to support the women and men, quite honestly, that are employed in our businesses.
Dr. Rhodes.
So I'm going to take a word that both Keith used and that Katie used, and I'm going to combine them. So between collaboration and intentionality, I think between the private sector, the public sector, and the the government sector, we really need to work together, because I think we've been so siloed before where there wasn't any cross-partnership or cross-pollination. And I think going through the pandemic, we've learned we can't do this without each other. There has to be a strong connection between all of us. I know for us with Braves and in the community and us working through things, we knew that we needed our partners. And even in my previous life working for the YMCA of Metro Atlanta, I knew how important and critical those roles were within our community, but they can't be siloed. And I think this is what's been taught to us. So doing more of this and making sure that we're coming together and creating coalitions that are very supportive for our workforce, for equity, for making sure that individuals have career trajectory, and to what Katie said, mindfulness and healthcare and all of the things that I know Dr. Rice is going to tell us about as well. But I think we have to use those two words, both collaboration and intentionality.
And Dr. Valerie Montgomery Rice, you'll get the last word on this. Where are we going to be hopefully a year from now and talking about women in the workforce?
We're going to be better. Now, we have much more work to do, you all, in terms of the pandemic, but getting the pandemic under control and getting more people vaccinated will be key to helping the economy recover and get women back to work. And once we get women back in that workforce, we are determined to work together to increase the number of women in leadership positions, particularly the number of women in healthcare and technology and all those places where we thought we couldn't sit. But we cannot continue any of our gains, you all. They will be short-lived if we continue to not have women in the workforce. We need those seats at the table. We need our voices to be heard.
And on that note, I want to say that we are also so proud of Veronica because she's going to be at that table. Now, Katie sort of mentioned it, but I have to say this. Congratulations, Veronica. We are so proud of you. Love, Mom and Dad.
Thank y'all. Oh my gosh. I love y'all. Thank you.
Those are the outcomes that we want. Thank you all for being a part of this conversation. I am always inspired. I'm just a journalist, so I try to bring people together and have the conversation. I can't tell people what to think or how to think, but I can give them something to think about. So I appreciate it so much. Keith Parker, I'm going to turn it over for you because I believe you have a small presentation to make.
Yes, we have a short commercial. We want to run only about 30 seconds. But first, let me thank the panelists. You all have been outstanding, everything we had hoped and more. But there's so much going on. And what we want to say more than anything else is that Goodwill of North Georgia is here to help. That no matter where you are in your career journey, come to us at careerconnector.org and we can get you started. If you are a person who is highly educated but looking for that next piece, or a person who's really never worked before, a person coming out of the criminal justice system, whatever, we can help you get to your goals and help you reach your dreams, no cost at all to you. So with that, I think we do have about a 30-second video to close us off. But again, everyone, thank you so much for a great, great hour.
Now is the time to go Goodwilling, to be a part of a mission to help our neighbors find meaningful, lasting careers. When you donate or shop at Goodwill of North Georgia, it goes to supporting job seekers right here at home. Just last year, we connected over 27,000 North Georgians with new jobs. Every cleared out closet and every great deal makes a difference. And it starts with you. Donate, shop, support job seekers. That's Goodwilling.
You know what, Keith, remember a few years ago when you first came on board and I met you at one of the stores and I told you I was looking for those bookshelves, right? Well, I got them, buddy, and I appreciate it.
Good stuff. Thank you so much, Rose.
Thank you. Thank you, everyone, for participating. Everyone, please stay safe. We really appreciate it. It's been an honor to moderate this conversation. If you need to learn any more information about the Goodwill, it's real easy, goodwillng.org. Be safe, everyone.
Thank you, Rose.